Hello again, this is Dr. Scott Pirochta from Healthy Life Dentistry, here to announce our June Facebook giveaway. And for the month of June, we are giving away a carotid artery scan. It is a $150 value, and it is in conjunction with our Healthy Heart Day, which is going to be Friday, June 21st, from 8 o'clock until 5 o'clock if needed. On that day, we'll be performing the carotid artery scans for $150. That is cost. I make no money on this. There's no kickback. There's no discount, but it is a wonderful service that I'm trying to make available to as many of my patients, family, and friends as possible. We'll also be doing a diabetic testing, A1C testing, and that is normally a $30 value, and we're offering that for $20. We are offering some blood pressure screenings for free. We are offering some blood oxygenation screening for free, some periodontal screening for free, lots of information, lots of pamphlets and information also on cardiovascular disease and its relationship to periodontal disease. Why am I so interested in cardiovascular disease? Well, that's an excellent question. I'll be happy to tell you. When I'm counseling my patients, I let them know that as a dentist, I want nothing more for them than for them to make it to the finish line with their teeth and for them to have healthy teeth and gums. But it's also my duty and obligation to let them know if there's anything going on in their mouth that could potentially affect their overall health, that they need to be informed and made aware of their options. I will also let you know that there is a selfish component to my interest in cardiovascular disease, and it's because I had the carotid artery scan performed and I performed very poorly. And so my cardiovascular, let's say it this way, my arterial age is 75 years old, and I'm a 55-year-old person. And that's not the situation that you want to be in. So it makes you aware of your condition, and it also makes you make some life decisions, what you can do to live a healthier life and possibly do some things to mitigate your cardiovascular disease. You can't tell by looking who has cardiovascular disease and who does not. And I've covered this numerous times before. There are people who have all kinds of risk factors for cardiovascular disease with respect to age and blood pressure and weight and certain things like that. And last year, several of those people had the carotid artery scan done and performed very well. There's not a susceptibility to cardiovascular disease, fortunately for them. And then there's the other ones who exercise, eat right, keep their weight in check, and you find out your arteries are full of inflammation and the arterial walls are setting you up for a potential cardiovascular event, which would either be a heart attack or a stroke. The carotid scan company does create a list of risk factors that they recommend for people to consider getting the carotid artery scan done. Obviously, if you have a family history of heart disease, if you're overweight, if you have increased cholesterol, if you're over the age of 40, high-fat diet, tobacco use, high blood pressure, diabetes, metabolic syndrome. One that I have added is the presence of periodontal disease. I've shared in prior blogs also that I also elected to have my sons scanned, the carotid artery scan, and at the age of 20 and 21, they're testing in the mid-30s from an arterial age. So once again, you don't know by looking, and it is incredibly important. You don't make any assumptions about presence or absence, and this is a wonderful way to find out your risk. If you take the test and you get a good report, life is good and everybody's happy. If you don't, then you have the opportunity to make some changes. And wouldn't you want to know early? Within my office, early detection of periodontal disease, early detection of decay makes for a very easy fix And the same is true, wouldn't you want to know if you had cancer? Your early detection is going to be a much better prognosis than what you would have otherwise. And the same is true with cardiovascular disease. We can't make assumptions, and finding out early that you are at an increased risk will do nothing but help you focus and make some lifestyle decisions to try to mitigate, again, cardiovascular disease. I've also commented in prior blogs that I believe cardiovascular disease is a preventable condition. And even if someone is in the midst of cardiovascular disease, and even if they have a more advanced cardiovascular disease, and that is something that I have learned through a preceptorship with the Brad Bale and Amy Doneen course and the Bale and Doneen method, and the authors of the book Beat the Heart Attack Gene. There are some obvious reasons why some people have inflammation in the system, and what you can do to eliminate the inflammation in the system, and then what you can do to stabilize the arterial condition that happens that sets you up for cardiovascular disease. So I am absolutely convinced that cardiovascular disease is reversible. So please, 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 if you have any interest, give our office a call, sign up for a scan, and we would love to have you come by and see us. Again, lots of information that we can give you at that time too. If you are interested in a free carotid artery scan, then by all means comment below, and do me a huge favor, share this post. I want for this to be available to anyone who has an interest in knowing their risk. I would like to also explain that the carotid artery scan that we're providing here is not the carotid artery scan that you can get either at your doctor's office or some of the church health days that they have. Those are scans checking for blood flow within the arteries, not with what kind of disease is happening with the arterial wall. And I'm convinced, once again, that catching this condition early on makes it much, much easier to make sure you don't have a cardiovascular event later. There's going to be a lot more information to come and lots more reminders. As always, our contests are random drawings. And so please, 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 once again, comment below, share this post, and we would love to see you at the event. This is Dr. Scott Pirochta from Healthy Life Dentistry, and I want to be a partner in your overall health care.